About 5 months ago, I did a video here where I mentioned that we need to be able to question our physicians and ask them questions while we're meeting with them. And that's still a very good policy to do. However, one of those things that I hadn't thought of at the time that I've been thinking about lately is that sometimes in order to be able to ask your physician a question, you actually have to listen to what they're saying to you. And you can't, let your mind wander because of some stupid reason, or probably a good reason, because I thought it was a good reason at the time. But I'm now recognizing some things, and when I thought about it, I realized that this is something my ophthalmologist has been telling me for probably at least 2 years. So let's get into it. I'm getting older. I'm in my early 60s, just is no wrinkles, so I'm happy about that. But I've noticed over time that seeing things has changed. It's not that I can't totally focus on everything, but like when I'm driving down the street during the day, the sun might be out, but it doesn't seem like the sun is out. Unless I see the sun, it doesn't seem like the sun is out. It seems like everything's a little fuzzy. It's not as sharp. I don't see the blue looking like blue anymore. I have trouble reading the signs, the street signs. I have trouble reading those. At night, if it's raining, if it's a wet road, I have trouble seeing the lines. I can't see the lines anymore. It's a little scary. I'm not going to lie about that. It's scary, especially when you have to make certain turns and you can't see the turns coming. And you see the lights coming at you from other cars, and that's a little bit frightening because they're kind of fuzzy. Everything's not focused as much. Luckily, you have your own lights so you can see straight down the road. But, there's times, especially when in my area, there's been snow, or maybe it's snowing, and you can't see everything the way you want to see it. And that's just freaky. So I always thought, it's my glasses. So I went to Empire Works or Vision Works, whatever it's called. I think it's called Vision Works now. I went there and they tested, really quickly. They said, nope, that's the prescription. That's what you have. So they had me look at the, the reader glasses that they have in a lot of drugstores. I'm not even sure if Wegmans has them, but drugstores have them. And they had them. Didn't work. And the last time I went to the ophthalmologist's office, the lady who did me first, because, you meet a whole bunch of other people who do stuff to you before he comes in, and he's usually only in there 5 or 10 minutes. Well, she gave me the number that I should be getting for the glasses, but when I went and I got those, tested them in the store, couldn't see a thing. So I started wondering, wonder if maybe there's something with my eyes, because I started having trouble reading things on the computer. I have a 32-inch monitor. It's a big monitor. I have the print that's a little bit bigger, but I have problems seeing the lettering against a white background. So for a lot of what I do, I have a dark screen. Like right now, where I'm recording the video, I'm looking at the dark screen with white, and a few things have red print, but I can read that. But if it's the reverse, I have trouble reading it. I've had to make Google, because I'm in Google a lot, when I'm doing research. I've got that in dark screen mode so that I can read everything. I have LinkedIn set up so that it's all different colors instead of that normal white background with black print, because I couldn't read anything anymore. So I did my little bit of research, and I have determined that I have cataracts. And it was a whole bunch of web pages that were basically saying I have cataracts. So I had to think back on it. I said, cataracts, what do I know about that? The ophthalmologist has been saying for at least 2 years, it may have even been 3 years, that so many years from now, you're going to need cataract surgery. I think he first said it like 3 years ago. Then he mentioned it again. This year, or at least September when I had my last appointment, he said, in a couple of years, you're going to need cataract surgery. And I knew nothing about cataract surgery. I have floaters. So I thought that my problem was because of the floaters. It turns out that floaters are just these things that get in your eye, or, in the background. They don't have anything to do with your vision unless you get a bunch of them, in which case they'll do something about it, but they're harmless. me having those floaters, which is what I thought the problem was, it turns out to have nothing to do with it. And when they do the cataracts, and this sounds really yucky, but I had to take a friend of mine to get her cataract surgery back in March for both eyes, so I had to take her 2 different times. They basically cut something in your eye and they pull out the lens, the natural lens that your eye has, and then they put the artificial lens in. And miraculously, for most people, within a couple of days, you're seeing really well. Some people see it perfectly. You have to do eye drops, you have to keep the eye moist and whatever, but you'll be able to see fine. I had no clue. So, like I said, I kept hearing this from him, but it never really stuck with me. And I started to think, you know what, this is my fault, because I kept asking him about the floaters and he wasn't really answering that question. He kind of answered it, but he wasn't answering it as far as my vision, which is what I thought the issue was. I thought those 2 things were related. And sometimes, this is the point here, sometimes you have to listen to what your physician is telling you. Matter of fact, all the time you should. But you need to listen, because if you don't listen, you're asking the wrong questions if you have questions to answer. Because that's what I said in the video 5 months ago. You have to ask your physicians questions. But if you're not listening to them, you're just not going to get it done. So this is the spot I'm in right now, where I need to have cataract surgery. I don't have the right insurance to get it right now. And this is what he's looking at, because in 2 years, I'll be on Medicare, which basically will be the primary insurance. I get cataract surgery then. The price is going to be much reduced than what it is right now, because I have a Blue Cross plan through New York State. And then all I have to worry about is the Part B, which I'm probably going to end up buying a Blue Cross, but it's a lot less expensive or costly than it would be if I went now, because I have a high deductible. How do you not notice this? And the thing is, because the vision got bad gradually, I never really just one day woke up and said, I just have trouble. I've been enlarging my font for a long time. And now that I've realized that's what it is, and I've changed a lot of things to dark mode, it's a lot better. But it's not perfect. I still have problems reading. For instance, okay, this is, if I wanted to read this, I have to take my glasses off because I can't read with my glasses. And I have to put it this close to me so that I can read it. Here, can't read it. Here, I can. Cataracts. That's what it's all about. But I'm just talking about cataracts. If your doctor starts mentioning certain other things and you don't know what those things are, you need to ask your doctor. What is it that you're talking about? How does this affect me? How's it affecting me right now? How will it change things in the future? And is this something we need to wait on? This is something I should wait on? We need to be more alert. We need to take care of our health in those ways. That's what I have today. Y'all, it's a terrible thing that we all have to go through this aging thing, but at the same time, maybe I'm learning lessons that I should have known because I work in healthcare, but maybe y'all will learn these lessons. Some of you, I hope, are younger than me, so you're learning the lessons earlier and you can take care of your health sooner. That's all I got. My name is Mitch Mitchell. Y'all let me know what you think. Let me know what your life is like. I'll talk to you later.